Can you hear me?
Hello?
Can you hear me?
Yeah, very clearly.
Very clearly.
Yes, clearly.
So, can those details of the case be put up on your screen?
Yes, madam, I have. Just a minute.
Yeah. Once it is put up, it's put up, right? So,
It's put up, ma'am.
yeah, so now let me explain. This patient is a 35-year-old who has a unilateral advanced keratoconus, and his manifest refraction is -6 with -9 in 55 degrees. And he gets a BCV of 612 with this correction. Uncorrected vision, of course, is less than 2 meters. And I'm going to go on to, can you go on to the next slide, which shows the topography? Yeah.
Yes, ma'am, it's
So it is obvious to all of you there in the audience that he has a very advanced cone. I think you have not yet heard Gitansha's talk on the segment planning, right? So let me explain to you. If the cone is a centered cone, here if you look at the posterior float, within the 3 millimeters, less than 50%, not even less than 50% is actually there. So it is a decentered cone. So that's the first thing you have to define. It's a decentered cone here. You need to know the corneal thickness of the patient, and that is the peripheral corneal thickness is of significance. So his peripheral corneal thickness at 6 millimeter zone is 580 micron. So then you normally would place your INTACS segment at 70% depth, but when the peripheral corneal thickness is more than 500, you could even get courageous and place it at 75% depth. And here the placement of the INTACS segment is at 430 micron, which is 75% of 580.